Good evening, everyone. I'm Lakshmi Aswarya, co-founder of MCS Medical Tourism. A warm welcome to today's webinar on Neurodevelopmental Excellence Abroad Parenting in Cerebral Palsy and Autism Care, organizing on the occasion of World Cerebral Palsy Day 2025. We at MCS Medical Tourism are committed to guiding patients and families from across the world to access quality healthcare in India. This section is hosted in collaboration with Balaji Robotic Health Rehab Hospital, a pioneer in advanced rehabilitation therapies for neurodevelopmental conditions. Balaji has been at the forefront for introducing robotic assistance therapies, multidisciplinary interventions, and evidence-based care for children and adults in cerebral palsy, autism, and other neurodevelopmental disorders. This is our privilege today to have with us Dr. K. Nithya Manoj, an expert in physical medicine and rehabilitation. I am delighted to invite Dr. Nithya Manoj to take us through today's section and share the expert on advancing cerebral palsy and autism care. Over to you, Doctor.
Very good evening to one and all. And first of all, I would like to thank MCS and the founders for giving me an opportunity to meet you all on this day of World Cerebral Palsy Day. Um, World CP Days, spinal cord injury days, these days they are not celebrated, they are observed. They're observed for a specific reason so that we are able to bring in the awareness about the specific disease condition and also spread hope that these conditions can be treated. So, thank you so much. And I would like to formally start my presentation. Lakshmi, is that fine?
Yes, Doctor.
Today's topic, I have taken the liberty of widening the topic. Though today is a cerebral palsy day, I have included autism care also because children with special needs and parents with children's who have special needs, they all have similar expectations, and the basic neuropathology and the treatment concepts between these conditions are overlapping. So today's topic will be neurodevelopmental excellence abroad. How Balaji Robotic Rehab Hospital and myself, Dr. Nithya Manoj, we will be able to uh, help your children perform better. That will be the core essence of the topic today, right? So let me introduce myself. I'm a rehabilitation physician. This is my 23rd year in rehab, and rehabilitation, as you all know, it's a very wide spectrum. We treat stroke, we treat brain injury, we treat urinary incontinence, polytrauma. Ortho rehab is like an ocean, in which pediatric rehab is personally my passion. So this is a topic close to my heart, and I'm really thankful for MCS Medical Tourism for giving me this opportunity. Today's theme for the CP Day is unique and united. So, what is unique? What is united? The phrase I always use for when I talk to anybody about cerebral palsy or any other pediatric disability is that these children, they are different, not less. This is the word I keep on repeating because these children with cerebral palsy or autism, both these children have a atypical neurological setup. Over all these years, I have seen parents with these children come to me with files, what to say, bundles and bundles of investigations and files, which scream at them saying that the child has this problem, cerebral palsy, this child has autism, and their eyes show a lot of fear. Their eyes show a lot of what to say, fear of the unknown, and a common thing is abundant of love for their children. So I would like to add a little more emotion to their eyes. The emotion is called hope. Hope is where the rehab team stands for these parents. And to give hope, we need to integrate innovation, fundamental basic therapies, and the family together for the well being of the child. This is what statistics say, that it is 2 to 3 per thousand live births and 1 out of 100 children globally. But of late, after COVID, due to two reasons. One is increase in awareness and decrease in taboo. There are a lot of parents coming to us for help. Second thing is, because of the social isolation that was caused during the COVID pandemic, a lot of children with speech delays and social what is it social skills are lacking in those children, and they come to us worried whether this is autism or not. So this population is increasing. On the other side, cerebral palsy, the improvement in all the medical care in pediatrics and neonatal care has decreased the mortality of children. Earlier, if the child is born before 30 weeks, the chance of the child surviving after 1 year is meager. But now, children's even born 28 weeks, 26 weeks, they have very excellent NICU care. And if the child reaches a stage of viability like 32 weeks, then the child definitely lives. But there are a few neurological impairments that happen on the way, and they end up in this cerebral palsy group. Um, this 1 by 100 statistics of autism is a published one, but as I said, the burden is actually more. One ethnic group in United States, they are seeing 1 in 16 children having delay in speech and social integration. So there are a lot of unmet needs in the neurodevelopment care. And as most of you know, this physical therapy, occupational therapy, speech and language therapy, sensory integration therapy, family training, all these things forms the basis for treatment. I will always say that the brain of your child is like a city, a hustling, bustling city which is full of traffic. Like any other normal child, our child also has all those parks, buildings, roads, pavements, pathways, driveways, signals, everything. But they do not function in the proper way, ending up in a lot of hustle and bustle, a traffic jam, what to say, uh, the movement is not smooth. So, likewise, our children also have all the capacity in their brain, but the car, the intelligence is not able to be not uh, able to express itself because of these malfunctioning roads and traffic lights. For this correction, this physical therapy, occupational therapy, speech therapy, they are the basics, fundamentals. See, if you want to grow a plant, soil is important. Fertilizer will add up onto a faster growth. So these therapies are like soil for growing the skill set of these children. So even if the child is getting only physical therapy, only occupational therapy, or only family training, only the mother is able to give certain therapies, I would say that you have given your best. So it has its own value. Though comprehensive therapy is the key, even minimum amount of therapy given at all times from the earlier times makes a very big difference. But what is the fertilizer or what is the advanced technology Balaji Robotic Rehab can offer? What is our expertise in making this better? I would proudly say that these core therapies are put all together as a comprehensive package in our hospital. This will be the first thing that we are doing. Above this soil only, we will be adding on the fertilizer of advanced technologies. So, what are the advanced neurodevelopmental therapies? Um, till now, rehabilitation and physiotherapy were almost the same. I would say physiotherapists are the rehab professionals who actually carry the burden all along and were doing the motor rehab part for the cerebral palsy children. On the other hand, for autism children, occupational therapists and speech therapists were the mainstay of rehab professionals carrying the load and helping the parents to improve, enhance, and um, make these services better. We have better neurodevelopmental tools available in rehabilitation medicine now. Brain was always considered a place not accessible. So when there is a problem in the brain during birth, cerebral palsy, autistic children, they do have certain problems in certain areas of brain. Certain areas of brain are underdeveloped or understimulated. Certain areas of brain are not functioning normally. They are, or certain areas are hypersensitive, as in autism. So these areas we are trying to reach through the areas they serve. For example, in cerebral palsy children, whenever there is a spasticity, we try to decrease it by working on the muscle because we didn't have any other modality to reach the part controlling it in the brain except for medications. These new muscle relaxant medications had a very big side effect of sedation. So what good it is for the child if it is going to if the child is going to sleep and the spasticity is low. It should be low when the child is awake, right? The same way, in occupational therapy and the traditional therapies, occupational therapists and they work hard to integrate the sensory impulses by working on the joints, giving weighted vests. So all these things, sensory integration, they try to do to bring down or calm down the hyperactive areas or hypersensitive areas in the brain. How good it will be if we are able to access these areas directly. Why can't we stimulate the areas which are overworking, I mean underworking? Why can't we calm the areas that are overworking? Can that be done? Yes, there are a few technologies which have made it possible that this can be done. So this is a not an exclusive or all inclusive list, but these are one of a few of the advanced protocols that we are able to offer. The soothe therapy is one of a kind where actually there's an interesting note I want to tell you about soothe therapy. Uh, soothe therapy is used for improving the neck control and posture, balance, and improve walking for cerebral palsy children. This one was actually designed um, by the Russian space mission. the Russian Space Center, they designed a suit therapy to help astronauts who went for space missions. When they came back, because they were floating for all this time, what happened is there is no gravity there. So all anti-gravity muscle. What are anti-gravity muscle? The muscle used for holding our neck back, making us walk on our legs. All these muscles got wasted because it was not used. So when the astronauts came back, they were not able to sit straight. They were not able to walk. So in their astronaut rehab program, they started using suit therapy for helping them. This is the similar case which is happening for our children. Children, they are floating in our womb. For 9 months, they are floating in the womb in water, right? After birth, the anti-gravity muscles start getting stronger. That is how they get their neck control, back control. They hold their neck, they sit, they stand, and they walk. But this development is impaired in case of cerebral palsy children. So for them, we have adopted some similar kind of suit therapy. We have got it from the Space Research Institute of America, USA, and then we have got it modified for kids, and we are able to use it. Um, then comes the functional electrical and brain stimulation. Functional electrical stimulation is a kind of stimulation where you help the muscle work, and the feedback of the muscle moving is integrated into the day-to-day function. For example, if we are going to stimulate our hand muscles, that is integrated with all the muscles involved in grasp, release. So instead of just moving the hand this and this, like this and this, without any purpose, the child starts to grasp and release. So a functional movement associated with electrical stimulation gives a better outcome. And then comes the brain stimulation. I would really, I'm proud to say that Balaji Robotic Rehab Hospital is the pioneer in this field of brain stimulation, especially for pediatric. We have five different kinds of brain stimulation procedures, ironically or accidentally equivalent to the five senses that we use, right? So we have auditory and visual stimulation, through which we are able to stimulate the hypersensitive or hyposensitive areas of our brain, especially for autistic children where they have sensory disturbances in these areas. Then we have stimulation using transcranial direct current stimulation. When we say using of current stimulation, brain, children, all these words put together are scary usually. Our parents, they get scared, but it is very safe. All the treatments given are US FDA approved, internationally approved, and approved by DCGI of India as well. And they are not research based or experimental things. They are cleared for usage for children for these conditions. So using these stimulation, these are very minute, like 2 milliampere of stimulation passed through specific areas of brain, which are mapped using brain mapping techniques, looking at your MRA and looking at your what do you say? Looking at the sensory profiling and the functional profiling of the child, we decide where to stimulate, how long to stimulate, and how to stimulate. We also have repetitive transcranial magnetic stimulation, which are used in kids above age of 9 years, and this has been proven to be very effective in reducing dystonia. Yes. So dystonia treatment is, I would say, it is a radical improvement, because the last 2 decades, that's one kind of cerebral palsy which we were not able to tackle with routine physical therapy and medications. They will need a lot of medications, and as I said, end up being sedated or weak. And when you give only therapy also, it doesn't stop. So this transcranial magnetic stimulation, when we are focusing on the specific area, we are able to get good results, at par with Botox injections, I would say. And then comes the robotic and sensor based rehab. So, a robot, what is a robot? Always, when we say, we always rely more on manpower than machine power, especially when it comes to children, right? So, when we talk about robots, robots are machines which are automated, and they have a sensory feedback, so that they work better and easier, and they work along with our children to help them walk better. So it is actually similar to the automated machines, but it is safer and a lot more better for motor recovery. And then we have the stem cell adjunct therapy. Stem cell injections, yes, over the last 3 years, we have given quite a few children with stem cells. Stem cells are cleared for safety in India by the Drug Commission General of India for use in children and adults. So the safety has been established, and it is cleared for use. But the efficacy has been established in few cases like arthritic changes, ligamental issues, and other few conditions like vascular problems and skin lesions. Uses and benefits with um, children with cerebral palsy and autism, it is still equivocal. We have seen children who have improved very well with after a stem cell injection, and we have had children who have not shown even a single response. So I personally hold it for the last, or for certain indications which they work. It is very much individualized, and we cannot say like physiotherapy, occupational therapy. I said it is for everybody, but this stem cell, it is not for everybody. We reserve it for certain cases where clinically we feel that it will give a better outcome. Also, we have got certain brain stimulation procedures like hyperbaric oxygen therapies, which has been proven clinically to be effective to reduce the spasticity and improve the outcome in autism as well. We integrate we integrate all these advanced protocols along with the fundamental basic therapeutic modalities tailor made for each and every children based on our evaluation. So all most of the parents who are treating these children, you know that it is a long pathway. It goes on for months and years with no end at sight. These advanced rehab protocols, they come as a help at hand in this case only. Here, we are able to give statistically significant improvements with a 100-day intensive program and 50-day follow-ups each. In this phase one, we go for a multidisciplinary assessment and goal setting for each child, and we give a daily integrated therapy which might go for 2 to 3 hours, robotics, brain stimulation, family training, everything. And we have a policy of going in for a functional review or an evaluation review every 30th day or 45th day as needed. So, what do we do in the first 100 days is setting the stage and pushing the child forward one step. And then the phase 2 and 3, we consolidate the gains and then push them further. So, this way, we are actually, the parents will be able to plan for a specific period of time. Most parents, they end up running to and fro for these children's treatment from one place to another, that their life totally runs around these children's treatment only. With these phased protocols, we are able to space it adequately. The child comes here, gets a gain, go back, and come after a few months. Phase 2 is 50 days, phase 3 is 60 days, so 50 days. So by planning it in multiple phase, we are able to include the family's um, what is it? Families' lives also into place. So, am I? Are you all with me? I've been talking for quite some time. Uh, Lakshmi.
Yes, yes, doctor.
Okay. So, how long has it been? I didn't know the time also.
37 minutes now.
Oh, okay. So we'll go in for a few examples and just as a story of hope, right? So we have children with spastic diplegia who have stayed for 100 days and taken steps, and they have walked few meters unaided at discharge. We have children who have autism. We have had children who had autism. I would mention about a child who had non-verbal autism, 4 to 5 year old. She came from US, who had undergone all ABA speech and sensory integration program from 1.5 years, but still they had didn't they were she wasn't able to speak. But after using that brain stimulation protocol and an intensive protocol, she started speaking in 3 months. So now, after finishing the 3 phases of treatment, she has been integrated. She's 6 years old now. She has been put on an integrated classroom in US. So we treat children even in their teens, where we do not promise a complete recovery, but we are able to really give improved ADL independence. So finally, the impact that speak numbers. We have treated more than 300 plus children who have an average gain of 65 to 70%. And 85% of families, they continue follow up with us. And we have a patient satisfaction score of 4.9 out of 5. And where does your if how does the child's journey go? We start with the comprehensive evaluation, personalized therapy plan, and then go, even after the completion of treatment up to that phase, we go for a milestone tracking program so that we ensure the child keeps up with their milestone later also. So how to begin? Book a consultation, we'll go for a comprehensive evaluation, personalized plan, and then start therapy. So I complete my day by saying that our children with cerebral palsy and autism, they're different, not less. Thank you so much for your attention.
This is for an insightful and inspiring session. Our team personally visited her hospital, and it was a very amazing experience for us. Dr. Nithya has dedicated her career to improve the quality of life who have neurodevelopmental challenges through innovation therapies and compassionate care. On behalf of MCS Medical Tourism and Balaji Robotics, I have a very good thank you to Doctor. And this is a time for any question and answer section. If any participants have any questions and can ask quickly.
Anybody in the participants, if you want to have ask me something, please do ask. And
Yeah,
Lakshmi, yeah, please.
this is Smita here. Uh, Thank you, ma'am, for the good presentation. I'm a physiotherapist.
Okay,
Just I would like to know when we do this advanced program, how do
okay.
we integrate our regular PT, OT speech also? Do these children take all those conventional therapies and this is like add on, or how this is being planned and explained to the parents?
As I said, the conventional PT, OT, and SLP are the soil. That's what I mentioned again and again. Without the soil, only the fertilizer will not work. All these
Yes.
advanced therapeutics will enhance the outcome of the conventional therapy. So,
Okay.
yes, as a plant can grow without fertilizer, it will be a little slow, that's it. But then it cannot grow without the soil. So the conventional therapies form the baseline, but definitely these advanced technologies. I will tell you a data from a study that I did. Right, it was a data for 12 years. There was a time where my rehab team would struggle to get a neck control in a children with global developmental delay. It used to take 6 to 8 months at times. But after these advanced therapeutics, consistently we are able to achieve neck control in 8 to 12 weeks. So months has come down to weeks. That is a significant improvement. Yes, alongside the conventional therapies, these advanced technologies really speed it up, but it will not work without the conventional therapies.
Thank you so much.
Thank
Ma'am,
you.
I'm
Yeah,
I'm Dechi here.
please tell me.
I'm an occupational therapist, come
Okay.
in developmental. Okay, ma'am.
Okay.
Ma'am, I just have a doubt. Like, how long? Like, for example, we work with a child with auditory stimulation and vision stimulation,
Okay.
also.
Okay.
Okay. So, if a child comes to you, how long a child may take? I know it depends upon each child.
Yeah.
Okay, for these, so approximately, like if you have to tell the parent how long this thing takes. See, we can't
Uh,
give guarantee of everything. That we
See,
know, ma'am, because when we are,
we have patients from almost 8 to 10 countries. So from all
okay,
cities in the in India,
okay,
they are not going to stay with us forever, and I'm not
yes,
going to
ma'am.
send back the child treated or cured. So
Yes,
that treatment planning will be like this. So this 100 days, we achieve a milestone. We
hmm.
always contact the rehab team at their own place, be it
Okay,
Australia, be it Yemen, be it Kochi, wherever it is. We
okay,
contact the rehab team back home because they
okay,
are going to consolidate and maintain whatever gain we have had.
yes,
So I have a very wonderful rehab team with me. We are a team of 25 people, and
okay,
many of our therapists are traveling with me for more than a decade.
okay, ma'am.
So they coordinate with the team back at home and
Okay,
make sure they continue the therapy. It is spaced like, see, when they are coming from out of the country, they plan it like once in a year.
yes, ma'am.
This year they'll come and stay for 100 days, then 50
Hmm.
days, then 50 days. That is what we did.
Okay,
In India, what we do is always there is an elder sibling, younger sibling, or a family. The mom or dad will be working.
yeah,
So
elders, yeah,
based on their holidays, they will come for quarterly holidays, then for half-yearly holidays, and then for annual holidays. So this is how we work. In
okay,
between, the rehab team back home, they will be working with us.
Okay, okay. Okay, ma'am. Because I got one patient from Hubli. I'm staying in Mysore. Okay,
Okay.
so one parent who came from Hubli who had done the stem cell therapy.
Okay.
Okay, and they were taking the therapies over here. And the
Okay.
child was improving. So I
Okay.
just, in case if you have to recommend the parents to you, so how it works, that's what I just wanted to know. I got the clarity, ma'am, now.
Yeah. Stem cells, they have minimum, I need 50 days. Minimum 50
Okay,
days is needed after a stem cell therapy. Um,
okay,
Stem cells work best with all these
okay.
brain stimulation protocols. Most children, they show improvement, but
Hmm.
still statistically we are not able to establish a correlation between stem cell alone and therapy alone, because I personally feel that it is not ethical to withhold conventional therapy for a child for research
Yes,
purposes. So it is like we
yeah.
are just comparing, because the age, it is only a few months, 24 months that we have got for the maximum potential. I just
Yes,
want to
ma'am.
make sure that they get everything at that time.
Yeah,
So
that's what even I was doing for the inclusive therapies, ma'am. Like they have to take all the therapy at one place so that the
that's
parents
right.
should not
That's a
run
right way
around.
to go. That's a right way to
Yeah.
go.
So that's how I plan my center here. So I
Okay.
just wanted to like every time we think of helping, it is not that only we can work and bring changes. I usually tell parents it's not only we who can do the changes. So anything like this, when it comes, it is very, very nice to hear also, and we can tell the parents to go and do these type of therapies
See,
also.
there are resistance levels met.
Yes.
So um, there are times when I felt frustrated. I let me Lakshmi, can I take 5 more minutes? Are we running late?
Yep. No, no, sure. You can take.
Okay. So, personally, let me tell you, the Balaji Robotic Rehab Hospital. Balaji is my brother, my only
Okay.
brother. He was a
Mm.
special child. So, he is the
Okay.
reason I became a doctor. He's the reason I took rehab. He's the reason I'm
Okay.
doing pediatric rehab. Okay. He's no more.
Okay, ma'am.
But there have been time where I used to be frustrated sitting on the other side of the table, not knowing what to
Yes,
do,
ma'am.
what else to
Mm.
do. And that
Yes.
quest has made me bring in technologies from all over the
Mm.
world. I
Okay.
can confidently say whichever advanced technology in any country of the world
Mm.
at this point
Okay.
of time, you tell me a technology and we have it.
Okay.
It all
Yeah,
the
because
technology
nowadays, uh, yeah, nowadays normal kids like only speech delay they are coming, ma'am. Like it
we
is
can
like
actually
all the
help.
things.
Actually help them accelerate and send them back.
Okay.
See,
Okay.
as I said, they will definitely need occupational therapy. They will definitely need speech therapy. There's
Yes.
no
Yes.
question about it. But
Mm.
when we add upon brain stimulation program, when
Mm.
we look into their fecal composition, work on the gut-brain axis, when you're able to you add certain supplementations and medications,
Mm.
definitely it is faster.
Yeah.
It is reducing the time duration of taken for
Yes.
these children to become better.
Okay. That's what we are like spectacles for giving some other like brain stimulation syrup and all those things. Parents come with those things, so
Okay,
we don't feel like recommend certain things. So if we have a thing like this, at least we can recommend and tell them, okay, these are the things. If we also know, it is better to help the parents. That's the main motto of my thing, ma'am. At
that's
least it will be helpful for them. Hmm?
okay.
Okay. Thank you. Thank you, ma'am.
Ma'am, good evening, ma'am. Can I ask a question, ma'am?
Yeah, please.
Yes, ma'am. I'm Vidya. I'm a physiotherapist, ma'am. Ma'am, I actually have two questions, ma'am.
Yeah, please tell
Ma'am,
me.
first question is like, how do you choose? We have enumerated all these techniques. So, how do you
Okay.
choose technique or do you use a combination of techniques for a particular child? So that is my first question. And the second question is, apart from regular monitoring for outcome measures, do you have any specific measure for specific technique that you use? Like example, like machines, do you monitor the settings in a particular
Yeah,
machine, which will
I get your question.
yes,
I get your
yes,
question. I'm just thinking of the answer, right? Vidya, for autistic children, we use specifically ISA, Indian scoring for autism. Indian scale of autism, ISA we use. And for CP children also, we use the normal spasticity scale rating and ADL scales only. There is no special scales that we use. This is the answer for second question. So this is all standardized. Whatever standardized scales that we all use for all these years, that's only we use. And how do we choose patients? Yeah. So each of these modalities, each brain stimulation protocols, they have a mode of action. They have a circumference of action. They have a depth of penetration. As a therapist, you will know where to use an ultrasound and where to use an IFT, right?
ma'am. Yes, ma'am.
Similarly, there are certain things, say, for example, transcranial magnetic stimulation, the depth of penetration is 8 to 10 millimeters. If it is a peripheral stimulation, it is 8 to 10 centimeters. Transcranial direct current stimulation means it is going to run across from the this skull to the opposite side of the skull. So we choose based on the MRI reports, the clinical picture of the patient, and then we decide on it. And personally, what I do is we work with the conventional therapy for the first 2 to 3 days. We see what all works. Where the problem arises, we see which area is needs a push, and for that we use advanced technologies. Based on that, we set the goal, stimulate, finish it off. It is all these stimulation protocols will run for minimum of 5 days to maximum of 40 days. Within that,
Okay.
if we are not able to achieve a goal, we take a check. If I'm going to plan for 40 days therapy, we take a check at 20 days or 10 days even. We'll see if the scores are improving, if we are going towards the goal. If it is improving even a little, we continue with the modality or we change the modality. It's like using any other tool, Vidya. Only thing is,
It's
oh, we stand, look back, and see whether we are going on the right way. And as I said, I always recommend conventional therapy. That's the baseline. If it works, I don't interfere. If it doesn't work, or if there is a block, the child has been taking a therapy for quite some time and not able to sit, then we'll have to work on the back muscle, extensor muscles. If the child
okay.
is progressing normally and fast with the conventional therapy, we don't interfere. As I said, the children are there in nook and corner of each city and each country. So it is important that we utilize maximum of conventional therapy with a sprinkle of advanced technologies to push it up.
Okay.
That's the take.
Thank you.
Just one more question to add on.
Yeah, please.
Uh, uh,
Who is that?
is it working? Yeah, Smita here, ma'am, physio.
Okay, please tell me.
Okay. Is it working for children, even who those who have seizure activities also? Because this is
Uh,
going to have a
yeah,
brain
this is a very
stimulation.
valid question. Yes, it's a very valid question. Uh, all these brain stimulation protocols, all these protocols, they have a seizure potential. The children are prone for seizures. What we do is, we when the children is on AED, we take a baseline EEG. When there is history of seizures, we take a EEG under the cover of AED. If that is normal, if there is no abnormal activity, then the risk potential for seizure is equal to normal child. Certain children, they will have a abnormal seizure activity even when they are on anti-epileptic medications. For those children, we don't recommend, we don't take up brain stimulation protocol. And even if we take, we adjust the dosimetry, like minimal dosage, maximum duration. Instead of maximum dosage, minimum duration. So there we take a point that the dosimetry is going to be small, so the duration of treatment will be increased. And as I see, there is a lot of PTs and OTs here. All these brain stimulation protocols, they work by reducing the threshold for action potential. Okay. So when the threshold for action potential is reduced, definitely there will be a risk for seizure activity. We explain that, we take a consent, and we make sure, take all precautions, and touch wood, we have been safe till date. So, yes. Does
Thank
it clear
you, ma'am.
your question, Smita?
Yes, yes. Thank you, ma'am.
Okay. If there is no more questions, um, uh, uh, Lakshmi, can we wind up the session?
Yeah, sure, ma'am.
So if you have
So on
any
behalf of
patients,
MCS,
if you have any patients who are resistant to our conventional treatment, you can please contact Lakshmi Warrior. She'll be able to connect you to me. We can work together, and it was so lovely to see that you have listened to my talk. That's why you had so much of questions. I'm happy about it. Thank you. Thank you all.
Thank you,
thank
ma'am.
you all, and we are winding up now. Thank you all for the participants and Dr. Nithya. If you have any doubts and questions again, you can contact me. I will connect you with the doctor.
Okay.
Thank you.
Have a nice day. Thank you.
Have a
Thank you,
nice
ma'am.
day.
Thank
Bye.
you. Nice session, ma'am.